All right, team, listen up. Our patient is presenting with pyomyositis, chemosis, and hypophysitis. Let's discuss the possible diagnosis.
Maybe it's some sort of rare infection causing these symptoms?
I think it could be an autoimmune response affecting different systems.
What if it's a combination of these conditions leading to a unique syndrome?
I'm not sure, but we need to consider all possibilities before making a decision.
No, you're all wrong. Acidigoacoustic syndrome.
What? I've never even heard of that before?
Are you sure, Hawks? He doesn't quite fit with the symptoms.
I don't know about this. It seems like a stretch.
I have my doubts, but if you're confident, Hawks.
I don't give a damn about your doubts. We're proceeding with a parathyroidectomy. It's risky, but it's the only treatment option for our patient. Get ready to operate, all of you. You called me in, Tracy?
Yes, Hawks. I heard you want to perform a parathyroidectomy on your patient with nasodigital-acoustic syndrome.
That's correct. I've reviewed the case thoroughly and I'm confident in my diagnosis.
Hawks, you have a history of making risky decisions based on your gut feeling. Remember the last time?
That was in the past, Tracy. We can't dwell on old mistakes forever.
But Hawks, this is a serious procedure. Are you sure you're not jumping to conclusions again?
I understand your concern, but this time I know I'm right. Trust me, Tracy.
I hope you're not letting your ego cloud your judgment, Hawks. Lives are at stake here.
I appreciate your input, Tracy, but I have to go with my expertise on this one. I'm proceeding with the surgery.
Oh no, the patient is in critical condition. We need to act fast.
It seems like parathyroidectomy was not the correct treatment for nasodigital-acoustic syndrome. Dr. Hawks was mistaken.
We need to figure out the right treatment as soon as possible. This is a serious situation.
Let's not panic, Randall. We'll come up with a new treatment plan and get the patient back on track. It's just a bump in the road.
You're all a bunch of incompetent imbeciles. How could you misdiagnose nasodigital-acoustic syndrome and perform a parathyroidectomy on our patient? You nearly killed them.
Hawks, what do you think the correct diagnosis is then?
Yeah, we need to know so we can treat the patient properly.
Please, tell us what you think it is.
We need your guidance, Hawks. Please, enlighten us.
You don't deserve to know. Figure it out yourselves. You bunch of morons. I'll be in my office fixing all of your goddamn mistakes. So, Johnson, how are things going in the oncology department with your patients?
Oh, same old, same old. Some are responding well to treatment, others not so much. It's always a roller coaster in oncology.
I see. That must be tough. Speaking of tough cases, I've been mulling over this particular patient of mine with a mysterious set of symptoms.
Oh yeah. What's going on with them?
Pauses, deep in thoughts. I think I've got it. It all makes sense now. Excuse me, Johnson? I have to go.
Wait, what? Hawks? Where are you going? What about your patient?
Sorry for storming in, but we don't have time to waste. I have a new diagnosis for our patient.
Hawks, where's your protective gear? You can't just barge in like that.
This is incredibly unprofessional, Hawks. We have protocols for a reason.
Listen, nasodigital-acoustic syndrome was a misdiagnosis. It's actually severe congenital neutropenia.
Severe congenital neutropenia. What's the prognosis, Hawks?
Prognosis is not great, but we caught it early. With proper treatment, the patient has a fighting chance.
How did you come to this diagnosis, Hawks?
I had a discussion with Dr. Johnson over lunch. The pieces just fell into place. I can't believe I made such a mistake with the diagnosis. It was severe congenital neutropenia all along.
Congratulations, Hawks. It's a big step to acknowledge when you're wrong and correct it.
If I didn't have to deal with incompetent doctors, this whole mess wouldn't have happened.
Ooh, wait a minute, Hawks. You were the one who diagnosed the patient with nasodigital-acoustic syndrome.
Well, my team should have caught that mistake before it got this far.
You can't blame others for your own misdiagnosis, Hawks. Take responsibility for your actions.
I need some air, Tracy. We'll talk more about this later.